South Africa is in the middle of a healthcare crisis, one that's not just about medicine or hospitals, but about who gets to access care and who doesn't. Over the past few weeks, I've seen protests erupting outside major public hospitals like Addington and RK Khan. The goal? To block undocumented migrants from getting medical attention. Groups like Operation Dudula and March are leading the charge, arguing that only South Africans should benefit from the country's strained healthcare system. Now, this isn't just about signs and chants outside clinics. Since the protests began, dozens of people, many who rely on chronic medication, have been turned away. Imagine showing up for your monthly treatment only to be told, "You don't belong here." That's what's happening. Supporters of these protests say it's about enforcing laws and protecting limited resources. They argue that undocumented immigrants are disrespecting South Africa's rules. Some even suggest that before any treatment, these patients should be arrested for being in the country illegally. But here's where things get complicated. According to South Africa's constitution, specifically Section 27, healthcare is a right for everyone, no matter where you're from or what papers you have. That includes emergency medical treatment. The law is clear. No one can be refused care in a life or death situation. Human rights advocates, refugee groups, and legal experts are pushing back hard. They warn that these protests aren't just blocking hospital doors. They're putting lives at risk and fueling division among people who honestly share more than they might think. And here's a question I can't help but ask. Why are we targeting fellow Africans, pushing each other away, while bigger issues like Western exploitation and ongoing inequality barely make the headlines? Instead of coming together to fix a broken system, we're turning on each other. It's a distraction from the real fight, building a fair, unified society that stands up for everyone's dignity. This crisis is a wake-up call. Healthcare isn't just a service, it's a reflection of our values, our fears, and our hopes for the future. The debate is fierce, the stakes are high, and the world is watching how South Africa responds. So what do you think? Is this about protecting resources or about protecting each other? Let me know in the comments. And remember, real change starts with empathy, not exclusion.